Hey everybody, it's Alex here from Aleks Physio. I want to talk a little bit today about scans, imaging, things like MRIs, X-rays, ultrasounds, CT scans, and kind of what they mean. I see a lot of patients that are coming in with disc herniations, with rotator cuff tears, with osteoarthritis that they've been finding on their scans. Patients are obviously coming to me pretty worried about the findings and what it means, and what their perceptions have been, what their friends have told them, what their overall views on some of these conditions are. Because when you hear things like disc herniation, degenerative disc disease, tears, arthritis, it invokes these pictures that are meant to illustrate, a lot of fear. Arthritis is bone on bone. Tears, you can visualize something tearing that, it doesn't seem like a very pleasant thing. Degenerative disc disease, just the term itself is very fear provoking. Disc herniations, visualizing just somebody's disc slipping out and your spine becoming unstable. These are all very scary terms to be thinking about. And one of my jobs as a physiotherapist is to try to educate them on what some of these scans mean and how they could impact our recovery, but what we can do on kind of, getting them on the pathway to success. So these X-rays, MRIs, ultrasounds, they're great at detecting a lot of the red flags. So things like fractures, things like spinal cord injuries, tumors, cancers, infections of the bone, or just infections in general. They're great at detecting these things. However, for the most part, a lot of the other things that you find, if those have been ruled out and you cannot see them on these scans, then they're generally nothing to worry about. And again, it's very hard to associate and correlate that because your disc is herniated at L3, L4, that's why you're having your low back pain, because you could have had that herniation before you had any symptoms. And the only way that we could be able to tell that is if you had that MRI the day before and then the day after you had the symptoms. So again, it's very hard to associate the two. Imaging definitely has its place, but it's just one piece of the puzzle in somebody's overall pain, because like we said before, pain is an experience that's related to actual or potential tissue damage, and it's an unpleasant sensation, obviously. So one of my jobs is to try to explain and to basically translate what some of these reports are that again sound very scary and very fancy and lots of big words, but again, they did a lot of research and they compare people who have pain versus people who don't have pain, and they find findings are similar across the board. So for example, if somebody is coming in with pain, they might find a disc herniation, but there are other people that have no pain and have the same findings on these imaging as well. So I don't say that to try to discredit people's pain, but try to give them the education and the knowledge that this isn't their MRI isn't their destiny. It's not. This is just how it's going to be. There's a lot of people who have severe osteoarthritis on X-rays, but have minimal to no pain, and vice versa. So it's about reassuring patients that it's safe to move, that it's safe to exercise. We just have to try to figure out the appropriate dosage, just like with medication, and the appropriate types of exercises to give to the individuals to try to get them back to moving and back to doing the things that they love. So, it's very important to educate, because again, people who don't know too much about these things, it's very fearful. So I really think that education, sometimes during the physio appointment, all we do is just spend the time translating the radiologist report, because again, radiologists are supposed to just comment on what they see, but they cannot correlate the what they see on the imaging to the patient's actual symptoms, because again, it's a lot more complicated than that. So let me know what you think about what I just said. If you have somebody or know somebody who has gotten an MRI that has said some of these things for their back or shoulder or knee or hip, share this video with them and let them know. And if you found this content was valuable, then like, share, comment, and subscribe, and give me some ideas for some new content that I can post, and I'd be happy to do so. Thanks for watching. Have a good day. Bye.